Stephen, there's been a lot of news of late about vaccinations and members of staff that are vaccinated and those that are not. Can I start by asking you, can employers force their staff to be vaccinated?
No, Chris, they can't is the short answer. There's no law in this country which enables employers to force employees to be vaccinated. There is an exception to that in care homes, which I'll come to in a moment. And the guidance from ACAS is that compelling employees to be vaccinated is likely to be illegal. I think because it's almost certain to be indirectly discriminatory against certain classes of employees. The exception to this is the law that has been passed to mandate compulsory vaccinations in care homes. But even that legislation, if you look at it carefully, has a number of exceptions to it, including those who cannot be vaccinated due to health reasons or because they're too young. And indeed, there are exceptions for things like maintenance workers who have to carry out emergency maintenance work. And for those who give comfort to the dying, they are also exempt from compulsory vaccination. So if one looks very closely at the picture, even where we appear to be moving towards compulsion, the compulsion, it's not entirely mandatory. And I see in the news today that the NHS is considering also introducing so-called mandatory vaccinations. But I suspect as well that will be subject to very substantial get-outs, simply on the basis that the NHS has such an enormous and diverse workforce. So the short answer is no, you can't compel your employees to vaccinate.
Abigail, there's been a great deal of news about vaccinations of late, and all sorts of different views around people who are vaccinated, people who aren't vaccinated. For an employer, what can he or she do if a member of staff who is vaccinated refuses to enter the office? It says, I'm going to work from home rather than sit in the same space as someone who isn't vaccinated. What are their options there?
Yeah, Chris, I mean, it's a difficult one and one that many employers are facing at the moment. I think in a situation like this, it's going to be really important to understand the particular concerns of the vaccinated employee, to assess both the reasonableness of their view and indeed whether their concerns could be alleviated by some sort of adjustment in the workspace itself, potentially if they sit in a different area or there's additional screening, etc. put up. Of course, if that employee has the requisite length of service, then they can always make a flexible working request to be considered under the relevant statutory process. But a simple refusal like this wouldn't in and of itself be a flexible working request. I think an employer will need to consider carefully the reasons why someone can't continue to work from home before taking any formal action. And of course, that's going to present some challenges itself when they probably have their employees saying that they've worked perfectly well from home for the last 18 months, therefore why can't they continue to do so? But I think there's a recognition that a lot of home working arrangements have been suboptimal over the last 18 months, and there is a real need to start to bring people back to the workplace. But of course, that has got to be looked at carefully by an employer before any formal action is taken. A refusal to return to the workplace, if an employer wants to force that through, needs to consider whether there are any underlying reasons for that refusal, such as disability, which may require the employer to objectively justify their requirement for the return, or indeed look at any reasonable adjustments. But assuming the employee could reasonably be required to return to work, then it's possible the employee could be investigated for misconduct for failure to follow a reasonable management instruction. My view at the moment is employers are being quite cautious before taking any formal action like this in view of the changing landscape of COVID, changes to the number of infections, potential new variants. So although disciplinary action is a possibility, at the moment, I think a lot of employers are being quite cautious before doing so and preferring to have a dialogue with the employee to see if any alternative solutions can be found. If an employee has less than 2 years service, then of course they don't have any unfair dismissal rights. So dismissal is at an extreme an option, but certain dismissals relating to raising health and safety concerns are automatic unfair dismissals and don't require a length of service. So that's why it's very important to understand the nature of the concerns of the vaccinated employee before taking any formal action.
So it's likely that most offices, as people go back to the office, are going to will have a mix of people who are vaccinated and probably a small minority who are not vaccinated. I can imagine that may cause some tensions in the workplace for those that are vaccinated, possibly having to cover a staff sickness if those who are not vaccinated become ill, or perhaps there are financial implications too around that. How should an employer manage those tensions?
I think employers simply have to be clear. They have to assume, I think, for the time being, that they're not going to be able to compel employees to be vaccinated. They can encourage employees to be vaccinated through providing financial incentives or indeed paid time off to become vaccinated. But I think there's going to be a minority who are not going to be vaccinated. I think as far as people covering for them and people getting sick pay when they're not sick because they're not vaccinated and therefore they're obliged to have time off if they're in contact with someone who has COVID. Those are difficult issues. And I think the best thing for an employer to do is to be clear in advance what is going to happen when those issues arise. So why do you have to take time off? Will it be paid? Will it be unpaid? And that people will have to cover for people in those situations as usual, it seems to me. That's the most sensible thing to do. But the thing for employers to do is to think about these things in advance, have a clear policy about it, rather than wait for the issues to arise.
Closely related to this, of course, is that employers have had to transform their office spaces, buildings so they are COVID safe. But if, of course, a number of their employees aren't vaccinated, I'm assuming that presents another dimension, potentially more and greater risk within that space.
Yeah, I mean, I think the starting point is that employers have a legal duty to ensure, insofar as is reasonable, the health and welfare of their staff and the statutory and common law obligations in that regard. The latest Working Safely guidance published for England in July this year sets out priority actions for all employers in preventing the spread of COVID in the workplace, and that involves things like COVID safe risk assessments, which employers should have done by now, and also the sector specific guidance. And employers need to follow those COVID safe precautions as part of demonstrating their compliance with statutory and common law obligations to the health and safety of their workforce. And whilst employers overwhelmingly can't force their workforce to be vaccinated, they can and must take those steps in the wider workspace to reduce the risk of transmission as far as is reasonably practicable. Ultimately, I think vaccination is only one of a series of measures to manage the risk of transmission in the workplace. And the reality is at present is we don't know whether the vaccine efficacy will reduce in time, or there may be new variants that may impact the effectiveness of the vaccine. So that's why it remains important to implement the other guidance in the workplace.